What led me to CMV was a patient care experience. I am a physician, I'm a pediatrician, and it was early in my training when I was a resident in pediatrics. Toward the end of my training, we had a very sick baby in the intensive care unit with cytomegalovirus. And I discovered that most of my professors didn't know anything about the infection. There was very little knowledge or awareness of it. This was in the 1980s, and so the cytomegalovirus genome hadn't even been sequenced yet. And so I went into infectious diseases. Everybody that went into infectious diseases back in those days wanted to study HIV. I thought I did too, but I was very interested in wanting to learn more about CMV. So that's how I proceeded. I went into a laboratory to study the genetics of CMV. It was very basic science kind of training. And then over the years, I kind of integrated that with my clinical experience, and that's kind of how I got started. I think in the United States, we are just kind of getting started with knowledge and awareness about CMV. We are very far behind our European colleagues, our colleagues in Israel, even our colleagues in Australia and New Zealand. They are the world leaders in advocacy and awareness about CMV. Almost every patient I've ever diagnosed or taken care of with congenital CMV infection, the parents have had the same response, which is, I never even heard of this before it happened to me. So what I like to do when I'm not seeing patients or in the laboratory is try to think about strategies that will help increase awareness. Because with awareness, there can come behavioral changes and interventions that can decrease the burden of CMV on newborn babies. And until we have a vaccine, that's the best strategy we have to try to decrease the problem of CMV infection in newborns. Many viruses that infect people spread throughout the environment and in lots of different animals, but not CMV. CMV only infects people. So CMV is actually one of those really interesting possibilities where if you had a strategy, you could eradicate it. You could get rid of it completely. So that would be a big step forward for pediatrics and for families, because CMV is actually the most common infectious disease in the United States and probably in the world that causes disability in babies. Think about that for a minute. The most common infection that causes disabilities. That's a big deal. And so if you could eradicate that, then all of those babies that are injured with CMV infection every year at birth, all of that could be prevented. So that's kind of my utopian vision for what the future could hold. My research kind of focuses in two broad areas. One is vaccine research. So I'm very interested in how one could design a vaccine that would prevent transmission of CMV to the developing fetus. Now, a second broad area of research in my lab is newborn screening. But I think if we identify all CMV infections at birth, then we can understand better the epidemiology, the impact on society. That will help inform vaccine studies. But most important of all, it'll help that family and help that baby. So I'm interested in what the best techniques and methods are for checking newborns for CMV. I'm interested in understanding from the perspective of the virus and the baby. Why doesn't every baby become disabled with CMV? There must be other factors, right? The different strains of virus, perhaps, or the different genetic backgrounds of people. Some people will respond differently to infections than other people. We know that that's true for all infections. So I'm kind of interested in studying and trying to understand what the factors are that predict whether or not a baby will have problems with CMV. So that's another area of research in the laboratory as well.